Hello, my name is Jesus Moran, and today I'll be talking about performance management of nursing assistants within nursing home facilities. What I learned and what others should learn from this presentation is that the relationship between nursing assistants and their supervisors is not always perfect, and it can negatively affect job performance overall. Nursing assistants will go through different kinds of appraisal reviews depending on the supervisor. Although these reviews may seem like a good tool to express concerns for bad work behavior within the workplace, some nursing assistants still manage to not be satisfied with these evaluations. The lives of millions of patients lie in the hands of healthcare professionals every day. Each healthcare professional has a duty and responsibility to give their best effort towards the care and in the help of revitalizing their patients until those patients are ready to become independent from the nursing care. It is important to keep performance standards within each facility high enough so that patients don't have to worry about careless employees. Performance management is an ongoing human resource function that will aid and monitor employees towards setting goals, designing strategies for improvement, and to provide continuous feedback in an attempt to make employees perform at their best in their daily routines. Nursing assistants serve a big role in the healthcare of the elderly. Certified nursing assistants are responsible for about 80% to 90% of the direct nursing home care given to patients. Nursing assistants are responsible for helping patients with basic living activities, measuring vital signs, housekeeping, and tending to the patient's problems. Nursing assistants take a huge responsibility in making sure the patient gets the best treatment they need, therefore performance should be the best it can. One of the biggest challenges to the performance management of nursing assistants within nursing homes is that there is a lack of trust between the employee and the supervisor while these performance reviews are happening. The process of reviewing an employee's performance will differ from each nursing home depending on the supervisor's interest. A variety of different activities can happen throughout this process, which may include self-appraisals, which are done by the employees themselves, or other kinds of performance appraisals. In a study conducted by La Salle University over a 6-month period, 2 nursing homes troubled by employee disengagement went under observation and discovered that some employees, along with their supervisors, did not agree with their performance appraisal results. In these facilities, performance appraisals were given every 6 months, which consisted of a collection of employee self-evaluations, supervisor evaluations of the employee, and subordinate evaluations of the supervisor. Employees were given questionnaires where they would answer questions on a 1 through 5 rating scale about work behavior. Throughout these appraisals, the majority of the employees' and supervisors' feedbacks seemed to align with each other, but a few of the results show no alignment of the answers between the supervisor and the employees. The lack of agreement during the performance reviews is not a good sign of a work relationship. Dissatisfaction with the results of these performance appraisals happens at low rates but are common within the health industry. In another study, 164 health professionals that included 119 nursing assistants were interviewed about the appraisal process that were given by their supervisors. Of the 119 assistants interviewed, 13 were not satisfied with the evaluations and 16 perceived these appraisals as a form of intimidation. If employees are not trusting the appraisal system within the nursing homes, then there will be a reduction in the improvement of work-based behaviors. The lack of trust in the effectiveness of these performance appraisals is alarming. To prevent misunderstanding between supervisors and nursing assistants, supervisors should set specific performance standards in which will help employees learn what their job is meant to accomplish, how it will be measured, and the expected level of performance. Once employees are fully aware what supervisors are looking for in these appraisals, the process will seem less daunting. To further reduce the backlash from the appraisal process feedback given to employees, it should stay positive. Supervisors should feel the need to support nursing assistants. Negative feedback is crucial towards the improvement, but it should be accompanied with something positive so the process doesn't seem anything dreadful to the employees. It is also known that employees will be more open and honest to the assessment if they contribute to the design of the appraisal process. Although nursing assistants are not at the top of the hierarchy within nursing homes, giving them a little bit of empowerment to choose the design of the appraisal process will not only increase the effectiveness, it would also increase job morale and satisfaction. To conclude, by changing the appraisal system to the suggestive needs of the nursing assistants and other healthcare professionals within the nursing home, the effectiveness of these evaluations will show more improvement in the employees. Supervisors, along with human resource managers, want to show their dominance over subordinates, including nursing assistants. But with standards too strict, they may lead to an unhappy workforce that can negatively affect job performance. Allowing subordinates such as nursing assistants to take control of their own appraisals will boost efficiency throughout the facility.